Sure. So that slide is up there just to remind you I'm not the nurse or the physician group at the table. Okay, so I wrote this actually on a plane a couple of days ago because I was trying to think about how to look at this from the perspective of an accreditor and credentialing agencies. And within our profession, we sort of have a lot of things all in-house, which is not unusual in the smaller profession. So we're responsible for each stage of the learning continuum, as well as the credentialing and the accreditation process within. So, you know, just to remind you from the learning continuum perspective, in our foundational learning, we have very little control over what goes on except for maybe prerequisites. At entry level, we have accreditation, which is that entry-level graduate degree. We all have some form of experiential learning. It sometimes is in a number of professions is within the graduate degree, or in others it's within a residency, or a lot of us now have optional residencies, as does PT, that we saw the model yesterday. And again, we have accreditation there. And if you look at the outcomes that we're primarily looking at within the accreditation world, and this is pretty consistent across all the health professions, we've moved to a competency-based assessment of the outcomes. So it's less about how you get there or how you deliver it. And I was kind of fascinated yesterday because we got into a lot of discussion about process, but really from an accreditation perspective, we're not going to tell you how to deliver it. What we're going to look at is what are those outcomes, what are the competencies that we're going to see coming out of this. And if you look at how those competencies are measured, there's like three major ways in which they're measured. The most common, first of all, is that the student or the graduate is assessed by somebody who is respected to have, or assessment by a content expert. Now we're assuming a lot there because we're assuming that the faculty or the person that's supervising the resident actually has that content expertise. That's sort of given assumption, but that, yes, I know, I see a lot of rolling of eyes, but that's the model that we're basing it on. Then once the person, but at both the residency and the graduate education level, we're really talking about programmatic accreditation, right? We're looking at the program as a whole. So we drill down to the individual competency, but that gets aggregated to an outcome that is reflective of the program. Once we get into the next stage, and I've just inherited this within my profession, but the continuing professional development, we're really looking at like two major areas that we have some control through credentialing. So we have the board and specialty credentialing programs, which are good, but in many of the smaller professions, this is a tiny number of our practitioners that are actually board or specialty certified. So the much bigger number of practitioners that are out there, the only time that their ongoing professional development is assessed in any format is when they come for renewal of their general certification or licensure. And the problem there is, you know, you're talking at like 52 different jurisdictions that put together what those regulations or those requirements are. And that's one of the big challenges we have, is how do we develop at the individual credentialing level some sort of assessment? So the first thing that we're looking at is like, how do we do that? And this is kind of the struggle that's going on in our profession at the moment. So the board and specialty credentialing, which is all in-house, we've moved to a competency-based model. Although we're struggling a little with the assessment. So like I said before, you know, you have that assessment by the content expert, which is the model in the entry and the residencies. But then when you start going to an individual credentialing, we have to look at alternatives. So the models that are out there are like a 360, 180 by their colleagues, or a self-assessment. And more often than not, everybody's sort of arguing towards this concept of self-assessment. But that gets kind of tricky, right? When we start thinking about somebody self-assessing their own competency. I mean, if I asked all of you to self-assess your own competency here today, you're probably going to rate yourselves pretty high. I mean, very few people are going to rate themselves low. So this is kind of where we're at right now, and that struggle is about how do we do that. And then, of course, the other piece is the continuing education, the traditional continuing education, which is nearly all knowledge-based assessment. There's very little competency. So where we have agreement in our profession so far is that knowledge-based assessments do not guarantee practice competency or the quality of OT interventions. We've got consistency about the fact that competency-based learning outcomes would best reflect that impact and value of continuing professional development. So we're on the same base there. And we also are in agreement that competency-based learning outcomes should be consistent with the profession's quality initiatives and support systems outcomes. For example, you know, in the rehab world, it's the Impact Act and those measures that come out of that. They give you a couple examples: decreasing falls risk, increasing safety, decreasing readmissions to hospitals within 30 to 60 days. So we're looking at those sort of factors. What are the competencies at the individual level which collectively for the profession would drive outcomes that would support our quality interventions? So we're in agreement there. Now, where do we not have agreement? And where we're getting closer is, okay, so what are those competency-based learning outcomes? What are the ones at the individual practitioner level that are going to reflect what we want to achieve? How do we assess them? So we've got 3 models, but realistically, what's the cost benefit and the cost versus the return for the practice environment to buy into this? And how expensive would that be? Obviously, the gold standard model, my colleagues may disagree with me, but they'll let me know, is probably that concept of somebody who's a content expert assessing you. But realistically, how are you going to have a content expert assessing every single person? And I was actually at a meeting last week and learned that the Canadians are actually doing a model where they pick a certain number of practitioners that they go out and do a competency. Okay, I'm getting my 5-minute warning. Moving on. So where are we in the process? And Malcolm wanted me to touch base on this, but we're really trying to look at, okay, so what would those competencies be? And we're starting with the outcomes. So there's a really good paper that just came out of Hopkins that looked at an intervention provided by an interprofessional team, which was an OT, a nurse, and a handyman. And it was associated with reduction in disability, reduction in readmissions to hospitals, and also reduction in depressive symptoms of community-dwelling, dual-diagnosed individuals, aging individuals. So we started with that, brought a group of people together and said, well, what are the distinct clinical competencies of an OT that contributed to this positive outcome? And it's interesting, people went to the low-hanging fruit straight away, right? They went to assessment of the physical environment, visual screening, functional cognition, identifying social supports. But then we got into the discussion, anybody on the team could contribute to those. That's really an interprofessional team outcome or competency that we need to look at. But there's something called an occupational profile, which every OT should be doing. And what an occupational profile does, in the bottom line, it identifies those daily activities that are most important to that individual. And irrespective of age, condition, whatever it may be that we're addressing, what you find is the real skill competency comes out of identifying what is important to that person. Because if that's where you can target your interventions through the team, that's where we're seeing the best outcomes. And that's kind of where we're at in the process. You're on.